The time is 31 minutes past 9 o'clock. It's a Thursday evening. It's the 1st of October. And more importantly, today is National Voluntary Blood Donation Day. It's a day I'm sure many of you who made it a point to go and donate blood at various centers here in Goa. And it's even more important now because we also have the COVID-19 that so many of our friends, family are kind of dealing with, and blood plasma is donating blood plasma is become very important. For that very reason, here on FM Rainbow, we have a very special half-an-hour session with Dr. Sachin Palyekar, who is right now on the phone line with me. He's from the Goa Medical College, and I have a couple of questions that I have lined in for him on National Voluntary Blood Donation Day. And apart from that, for those of you listeners, in case you have a question that you want to ask or you want me to ask him, you are more than welcome to WhatsApp me on 838-007-1054. So that is 838-007-1054. So we're going to go straight off and say a big good evening to Dr. Sachin Palyekar. Doctor, good evening. You are on the line.
Yes, very much.
Fantastic. Thank you at the very onset for sharing your time. Like you said, I'm sure you are like on your toes these days, super busy.
Yeah, you can very well say that. Okay, before we start off, I need to thank All India Radio and FM Radio, FM Rainbow, for giving us the time to, and a medium where we can talk to the population, and there are hundreds of people having hundreds of queries.
Right.
So I believe this would be a good opportunity for us to address these queries and try and solve them at the earliest. Because we're facing a lot of queries, and these queries need to be answered as soon as possible.
Right. I know because you can. Everybody knows about blood donation, but let's talk about the word plasma that comes into now so many. It's probably a new term for many of the laymen, and in view of the COVID pandemic that is on, what is plasma, and how is it different from blood donation?
Yeah, see, like you said, everybody is aware about blood donation.
Mm-hmm.
Plasma donation has been around in Goa for a pretty long time.
Okay.
So it's one of the components of blood, and the medical college blood bank is doing components, that is plasma as well as platelets, since May 2004.
Okay.
So now what is plasma? The plasma is the liquid component in the blood that carries hormones, nutrients, as well as antibodies across the entire body.
Right.
Now, the conventional plasma, when we talk about conventional plasma, so it's basically used in people who could be having liver disorders, basically anything which is causing any bleeding tendency, which needs to be corrected by something known as coagulation factors, which is available in the plasma.
Okay.
So the normal conventional plasma would get used.
Okay.
So now we have a term known as convalescent plasma. So now this is the plasma which is collected from people who were previously infected and have made a complete recovery from COVID.
Okay.
So these people would have antibodies in their plasma, which are important.
Correct.
Now, what are antibodies? Antibodies are proteins which are used by the body to fight off infections, and that's how they provide immunity to those who have already recovered from COVID.
Right.
The idea is that the same antibodies could be transfused to a patient who now is suffering from COVID, and these antibodies would go and attach to the virus, thus decreasing the viral load, and hoping that the complications in the hospital stay of the patient would be very, very much curtailed. So that's the idea behind using these antibodies. This is nothing new. This has been there in the medical science over the last maybe around 70 to 80 years. It's been used in patients previously with polio. Then you have patients with rabies, with Ebola virus, and in the recent past, the SARS and the MERS epidemic, which was there around 10 years back. So this is nothing new, but this is the same old technique which is being tried, and to varying success.
Okay. That's good. And just like blood donation, I think even plasma, it's according to your blood factor. I think
see, there is a particular protocol which we follow where a recipient of a certain blood group would be eligible to receive plasma from certain other blood groups.
Okay.
See, whereas with blood, O is the universal donor, where we say that once you have a donor who's O negative, that blood can be given to any patient.
Okay. And at present, what's the response, doctor, at GMC? I mean, is there a shortage for, plasma at the GMC blood bank?
See,
the reasons maybe?
The blood bank, since it has a single machine which is running at a given time, we operate it from 9 o'clock in the morning, and sometimes by the time we finish at 6 o'clock.
Okay.
We can take a max of around 6 or maybe around, if we stretch it a little bit, 7 donors per day.
Okay.
Now, the biggest advantage of plasmapheresis is that a single unit of plasma would end up helping 3 different people.
Oh.
So let's say we are able to plan our schedules very well, and then we have 7 donors. So at the end of the day, we have 21 units.
Yes.
But sometimes we find that the requests which are coming in from the COVID hospital, from the GMC wards, and the private hospitals who are admitting, sometimes the requests are maybe around 30, 40.
Okay.
So that's the reason we may not be able to satisfy everybody's request on a particular day.
All right.
So this is a limiting factor. It being a single machine which is being used at this point of time by the blood bank.
Correct. And like suppose a person comes to donate his plasma once, like can he is there a wait period to? Okay, I think we've lost doctor on the call, but Dr. Sachin Palyekar, who's in talks with us here and on today being the National Voluntary Blood Donation Day, about donation or donating blood plasma, especially to those of you who have overcome the COVID virus. And we are, of course, going to go back to him. But it's a very, very simple 2-step process. We'll be talking about that. So it's a simple screening of blood test that is done on one day, and then later the donation is done on another day, for which you are intimated by the Goa Medical College. So those of you who would like to, who have recovered from your COVID and are strong enough, can make sure that you all go there. Could you shed some light on, many of the, patients who have recovered from COVID, probably I mean, if they say, okay, we need to go and donate our plasma, so what's the process? How does it extract? How is it extracted?
Yeah, see, the guidelines which we are following at this point of time are the ICMR guidelines.
Okay.
So what in brief, basically what it means is that the donor who wants to come ahead to donate, the patient who wants to come ahead to donate plasma should have completely recovered himself from his illness.
Okay.
So now this has been determined as to be 28 days of complete recovery. Now, let's say you have somebody who was admitted to either the ESI COVID hospital or was quarantined in a COVID care center. So it is 28 days after discharge from either of these 2 centers, because it is assumed that he has been discharged because he has recovered.
Yes.
Now, let's say you will have a whole population now of people who have chosen home quarantine. Now, what happens is that it's a little different with these patients.
Okay.
So most of them who have much more milder symptoms, they have not had the complications. So it's a little different. So you have somebody who was home quarantined and he had symptoms, say, for 5 days, where he had fever, maybe body ache for 5 days, and then he says, after 5 days, I was fine.
Okay.
So then in this people, it is 5 plus 28 days.
All right.
You might have somebody else who's had cough. He had fever for 2 days, he had cough for 7 days. Then in that particular person, it would be 7 plus 28.
Okay. So even if they had not got them to self-tested, it's or
no. Wait. See, these are not people who have home quarantined or in hospital. These are people who have been diagnosed
already, yes,
and they have a positive test report with them.
Okay.
So that is mandatory. You might also have another population of people who were tested as part of contact tracing. They did not have any symptoms. They were absolutely fine. They did not even know that they had any illness, but the test came positive.
Okay.
So in this case, it would be 28 days after the date of testing, because they never had any symptoms.
Okay.
Yeah. So when somebody wants to volunteer for donation of plasma, we need some documentation that this person was positive for COVID.
Correct.
Because then that's what needs to be documented.
Right.
You cannot just take anybody and then conduct tests on him, because that would not be ideal.
Right.
So a positive test report, either in the form of SMS or the discharge card from either COVID care center or the ESI hospitals, people need to come ahead with that.
Right. So what's the response now? That you have lots of recovered patients who have been coming in? And
what we have been doing over the last nearly a month or so is we have been approaching the major industries which are there in Goa.
Okay.
So they have a database of people who they know were positive.
Yeah.
So we've been approaching them. We've been testing their samples. And then once we find a donor who is eligible, that donor is given a particular time and date, and he comes in for donation. Now, the plasmapheresis donation collection is a little different from normal blood collection.
Okay.
So, let's say you go for a blood donation camp, you just fill in the form. You will lie there on a bed. The needle will get, the needle will be put. Within 5 minutes, your blood donation is done. You wait there for another 15-20 minutes, and then you can leave.
Okay.
But whereas this is a little different, because we need to identify what is the antibody titer in a particular donor.
Okay.
Because, the kit which is used for generation of plasma is expensive.
Right.
So the government is spending 8,000 rupees on each kit.
All right.
So you got to select people who are actually eligible. You cannot just be putting anybody on that machine and then doing the test at a later date.
Right.
So what would happen if somebody tomorrow says, I want to go and donate plasma? So he needs to come to the Goa Medical College Blood Bank. We will look at his documentation, confirm that he has something which tells us that he was COVID positive.
Right.
Okay. Then what happens is that he fills the form, like a normal blood donation form. We go through all the details, and if everything is fine, then what we would be doing is that we would be collecting a small blood sample on which we need to do the test which determine the fitness of the particular donor. So that's like a complete blood count. There is a test for the liver proteins. Then you have the test for HIV, hepatitis B, hepatitis C, malaria, syphilis, and the antibody titer.
Okay.
So once we have this blood sample, we need anywhere from 1 to 1.5 hours for this test results to be ready.
Right.
So what we advise people is that, okay, you give us the blood and you go back to your work, whatever you're doing. We will get back to you at a later time if you're eligible, and we will give you a date and time, and you got to come at that time and we will take you. Because the procedure of plasmapheresis would take anywhere from 45 minutes to 1 hour, based on the weight of the person, the build of the person, the quality of vein. So many things matter.
All right. Okay.
So it's not something that you can just come into the blood bank and say, take my plasma. That's not possible. That's where we are having a difficulty with people coming and say, take my plasma. They're not understanding that this is not like a blood donation.
Correct. And doctor, now, many a times we get these messages from friends and families, or just about somebody who forwards a message like asking for, blood plasma. They say, so-and-so has been hospitalized, and they're claiming. So, suppose I was in that place and I don't know, I say, okay, maybe my friend needs plasma. So, can I go and get a friend of mine who has recovered and, then go through the test? Is there a phone line where we can call up or...
See, what we would tell the patient and the relatives who are interested in arranging plasma for themselves is that they should approach the blood bank right away.
Okay.
So only thing what happens is that, everything happens during normal working hours. After 5 o'clock in the evening, it is just emergency services which are being offered by the blood bank.
Correct.
We do not have somebody to talk to people 24 hours. It's not really an option at this point of time. So the request would be coming from the doctors, either from GMC or ESI. So it's the doctors who are talking to the doctors on duty in the blood bank. What the patient relatives need to do is that if they have somebody whom they know has recovered from COVID and could be eligible, they need to come to us with that donor.
Correct.
See, the generation of plasma is 18 to 20 minutes a day, whereas the requirement could be anywhere from 35 to 40.
Right.
So we would always give priority to any particular patient whose relatives have brought a donor by themselves.
Okay.
then we would definitely be reserving a unit for a certain amount of time for that particular patient, because we are in that tape to that particular patient for getting the donor.
Yes. And because that one person's plasma can be used for 3 more patients, right?
Yes.
Correct, yeah. That's really nice, because I mean, when you get a message, I'm sure it's going. So many of us are going through that. You get a message and you say, "Oh, this person needs."
It is very easy to forward a message, because that's what is happening. Is that people, without thinking, without reading, they're just forwarding messages, and I believe it actually creates more confusion. It would be good if the relatives come and meet us, talk to us, and we will see how we can help them.
Right. That's perfect. So. It's going to be during working hours from 9 to 5 that you need to come and, contact you all at the blood bank, right?
See, basically what happens is that the doctors who are treating these patients who send us the request, and they are communicating, there is a different channel for that communication. The patient relatives need to see the medical social workers and the other support team which works in the blood bank is available from 9 o'clock in the morning till 5 o'clock in the evening. So if donors were to come after that, there is just the basic emergency services. So are they going to take care of the emergency services, or are they going to spend half an hour talking to people? That's not going to be possible.
That's right.
So you're going to compromise somewhere else. So people need to come to us during normal working hours. Instead of coming and sending messages, find a donor, bring the donor. That would be the most ideal.
Fantastic. And is there any a helpline or any contact number where they can call up? Is there any setup that is there for
See, the way when the first when the plasma drive started, there are 2 or 3 numbers which were allotted by the Dean of Goa Medical College. These are the people who are responsible for arranging the plasma donors.
Right.
I will share those numbers with you in a while, so maybe you could announce them. It's actually there. It's been advertised in the newspapers and I think various other social media forums. So those numbers are common knowledge.
Okay. Yeah, but I think we'll share it with our listeners
as well.
Yes,
I will give them to you.
Yes, many of you have been asking for contact numbers about who you can contact to, and I think Doctor, you have the 2 numbers we'd like to share with our listeners.
Yeah, just a minute.
So,
okay, one is 7887.
So that's 7887
400
400
804.
Okay.
So she is Shraddha Kelkar.
Okay.
Who is one of the members from the SOTO team who is allotted this job of trying to arrange for donors.
Correct.
And second is Sister Marcelina.
All right.
Who has been right from the beginning, has been the face of this entire plasma drive.
Okay.
She's been working very hard. And give credit also should go to her.
Yes.
Her number is 9822
9822
79
17 32. All right. So to our listeners, you have 2 numbers in case you'd like to, know more information, find out more information or contact. It's Shraddha Kelkar on 788-74 00804 or Sister Marcelina Dias on 9822791732. We'll put up these numbers on our Facebook page as well, on the FM Rainbow Goa Facebook page as well for more information. And Doctor, I think anything else you'd like to tell us? I mean, we've spoken about plasma donation.
Just a few points as regards who is eligible to donate.
Yes.
Anybody from the ages of 18 to 60. Hemoglobin needs to be more than 12.5.
Okay.
You should not be having any major illnesses. Like say, if you're say mildly hypertensive or diabetic, which is well controlled, we can definitely be considered. But somebody with a heart disease, somebody who's had a past history of some cancer, or somebody is recovering from TB, typhoid, malaria, any major illness, that particular donor cannot be considered.
Okay.
One more very important point is that any lady who has had children is straight away ineligible to donate.
Okay.
There is a science to it where you might have antibodies which are there circulating in the lady's blood, which could react with the recipient's plasma.
All right.
So they are straight away out, because we have a lot of ladies coming in. Then we have an issue where they try to ask us why exactly.
Okay.
One more thing is you see one limiting factor for somebody to go plasmapheresis is the quality of vein which is there in your hand.
All right.
It is a 45-minute procedure. So the needle and that vein have to cooperate with each other for the plasmapheresis to be completed nicely and smoothly. So you might have somebody who fits all the criteria, whose antibody levels are good, but he may not have the best of veins.
Okay.
So what we do in such people is that we would be taking their whole blood, like a normal blood donation. We separate the blood and the plasma.
Okay.
The only difference here is that 1 unit of plasma can help only one recipient. Whereas plasmapheresis, you are helping three.
Okay.
One more point with plasmapheresis, the biggest advantage is that you can go on donating every 15 days till 4 months from the date of infection if your antibody levels hold.
Okay.
One thing which people need to remember is whatever scientific data which is there tells us that the antibody levels would be at their best approximately 3, 4, 5 weeks after the initial infection. So most donors would have a very short window of a month and a half in which they will be eligible to donate. So my request to patients who are bringing donors at this point of time to the blood bank would be to try and get donors who were infected by COVID maybe 1.5 to 2 months back, because they are the ones who are likely to have better antibody levels.
Right.
So getting somebody who was positive in the month of March or April or even May may not be such a good idea. Of course, if there is nobody else, we will definitely test them.
Right.
But it would be ideal to catch donors who have been diagnosed as positive in the last 1.5 to 2 months.
All right. So between 40 days to 60 days.
Yes, that would be ideal. And one more point which I need to stress on, now this is extremely important, is that the people who come to the blood bank need to understand that even around 30% of our own staff is quarantined. We are working with absolutely skeletal infrastructure. So when you come to the blood bank, you are going to need time. We are trying our best, but it is not possible to please everybody the way they expect. So whatever in the past may have taken 1.5 hours, you could be waiting there for 3.5 hours, because we are really stretched. So people who need to come there have to have the patience. We are trying to help them. What we need is a little cooperation from them.
Yes.
So if you come there and you start demanding, it's because it's not just, we're not just looking after COVID. We have to cater to the entire state of Goa, all the allied hospitals, with all the other surgeries and all the other patients who are going on.
Right.
So our technical staff is also compromised and we need time. So just a small request to everybody, please have patience. We want to help you, but you got to cooperate with us.
Yes.
So we have situations where people come in, then they start throwing names. That I will tell this one, I will tell this one, this is not happening. And that's very discouraging for us. We do not want that.
Correct, yes.
This is a humble request. People need to understand this.
Right. So, I think we've covered everything that we needed to about plasma. Is anything else that we have?
Anything else is that I need to thank my staff in the blood bank who have been going out of the way to do whatever work and complete work as they are doing. Everybody is really working hard.
Yeah.
And so whatever we have succeeded as of yet, I think we have finished. I think we've given plasma to now nearly 300 patients, which is quite a significant number. Even if we were to even compare with some of the major hospitals in the country. So every day the team works from morning 9 to 6. There is no lunch break. Everybody just eats simultaneously. As the donor is being led, people are eating simultaneously.
All right.
So we are putting in our bit. What we need is a little bit of cooperation and patience.
Yes. Hats off to you, doctor, and to your team as well at the GMC Blood Bank. And thank you, Dr. Sachin Palyekar, for your time, for sharing your time and sharing some very valuable information, I think, to our listeners. And I shall give the phone numbers once again in case you were still running to find your pen or paper, so you could write down the numbers. And so you can write it down. So doctor, I think it's probably a nice time to say goodbye to you. And
thank you very much.
Yes, thank you so very much once again.
Thank you so much.
Yes, have a fantastic evening and rest well before you go back to the front line. Yes, back to work tomorrow. Yes, thank you very much, Dr. Sachin.
Bye. Good night.
Yes, bye. Good night.